All right, so I'm back. It's Dr. Anthony G. Beck. I'm back here with Dr. Leland Stillman.
Good to be here.
Go and introduce him. It's pretty cool. My protege. Here's the thing. So in
one of many.
In a previous video, we talked about being a category 1 and how important it was to separate ourselves from everybody else or the diagnosis. We have another adage in balanced protocol.
Mm-hmm.
What is it? The Q squared.
Q squared, M squared.
Q squared,
Quantify,
M squared.
Qualify, measure, monitor.
That's it. So the first thing is so we're going to jump right into it. So the principle that's really important to understand is once you get and you accept the fact that you are not like anybody else, you have to determine how are you different than anybody else. Nice. And it's an initial step and it's a continual step, also known as the scientific method.
How about that?
How about that? You got to form a hypothesis. You got to gather some data. You have to do some tests. Mm-hmm. Okay, so Q square, M square, qualify. If we were working in some university, getting that grant money, that's the good
being
stuff.
paid the tax dollar money.
Oh, absolutely. Like the one lady, Rhonda, who's always like, well, this study shows that this study who ate this and did this have this. Rhonda Kirkpatrick. Anyways, I think it's what it is. Rhonda Patrick. Anyways. So there's people out there that love to just quote studies. Well, this study shows. There's even a YouTube channel that studies finds, or they start off with a study.
It's probably 95% of the health and wellness information on the web.
Yeah,
it's just about studies, which is utterly losing the skill of a clinician.
Yeah. Well, it goes against the first principle, balanced protocol, when we talk about being a category of 1.
Exactly.
Okay, so in other words, that's great. They took a whole bunch of people who have breast cancer, okay? And what they do is they go and they say, okay, well, these people, and we found if they took fish oils or vitamin D or turmeric or something like that, there was a 24% reduction in I'm doing that because I'm mocking the way the mouth moves when she talks like that. It drives me nuts. That's okay. People can mock me too. I have my little isms.
You do. We all do.
I do. We all do. It's fun. So my point is this. There was inclusionary and exclusionary criteria for that study. Like they took women who are non-smokers and did whatever. But what about all the women who are smokers or have a history of smoking?
Right.
Now it changes the whole thing. So what happens is somebody quotes you the study and you go, oh, that's me. I have breast cancer. Oh my God, I have the big C word, and I don't mean Cincinnati, right? It's a joke out there. Go Bearcats, right? And my wife's alma mater, she did her master's at Cincinnati. But anyways, a little sidebar information. The fun thing is that, so the big C, the cancer thing, like, oh, it's breast cancer. And they're like, well, what you got to do is take this, because the study shows that if you went plant-based but took fish oils or ate mushroom tea or coffee, that you had a whatever % reduction in tumor size. Okay, but no one goes and looks at the study that anybody quotes you. So if ever you do that, you're guilty of absolutely not giving yourself what you should if you're going to give weight to that study, that person quoting it. Your due diligence.
Your due diligence.
Yeah, because you'll find like, oh, well, between this age that lived in this geographic area and have no history of smoking, but if you were a smoker and you have breast cancer, boom. It changed it because you would have been ejected from the study.
Yeah. Does the study apply to you?
That's it. So the study doesn't apply to you.
Right.
Okay. So that's why you got to qualify. So everything that we do in balanced protocol is we're going to qualify the individual. Do they need this or not? Because they can say, well, we balance out all patients' zinc and their copper and their zinc to copper ratio.
Because you got to.
Yeah, it's so important. But here's the thing. Some people it's contraindicated because let's say you've been taking zinc because somebody told you it was good for COVID prevention. Okay, but then you're like, okay, well, I'm already taking zinc, but I need zinc for disease whatever. Well, what do you do then?
Take more.
Take more. They say, hey, listen,
that will not end well.
No, it's like me and barbecue. More is better. No. So, anyways. Qualify. You got to find it. Did you apply to that study if you're going to use that approach? And if you don't do that, which I could probably count on my finger. No, probably more than that. There's been a few patients in my time because I've seen so many, but it's rare that people actually do take the time to actually go look at the study and beyond the abstract, not the last conclusion or what it says and assume what it says.
Right.
So qualify. Now you got to quantify. Okay, well, it does apply to me, but how? Right? So how are you going to show that it does or not? Okay, well, zinc has been shown in this study to be useful in this particular insert disease state. So then if you don't know what your starting zinc is and you start putting more in it, that's it. That's like saying, hey, I have found that this gas is great for engines to reduce knocking. And you're like, okay, well, I have an engine that knocks. So then you're going to go, I'm going to go put more in there. And you should better check and see if you've got a full tank or not, because if you overfill it, then you're going to have a problem. So you can't just go adding new things into something because somebody quotes you some study. We never quote studies to substantiate what we do, except for the studies that we do through the advanced functional labs that we do on the patient.
Yeah, and if we talk about scientific studies, we're always explaining this information.
Yeah. Just to open up the realms that it's a possibility to take a look at that. That's why I like studies, because they'll go, well, they found this, and then that encourages us, our other fellow scientists to begin to ask ourselves, okay, well, let's explore that in the context of this, and then find other realms. So when we do these videos is we really try to learn you something, okay? So that way you can understand that it should make sense, not just doing things because you heard us say it or somebody else. We're always going to say, listen, you need to qualify and you need to quantify, find out where you're at. And then as you proceed through a method with any type of clinician, okay, integrative, functional, yada, 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 or not, or straight allopathic, you should be ongoing doing your quantification and see when is there a possible time when you should actually stop said supplement or medication.
Right. And of course, no one else talks about this because everyone else is making money, quite frankly, over supplementing people.
They are. It's incredible.
I mean, just today I was telling you about a omega-3 level that I saw on somebody who's been following somebody else's protocol. Their omega-3 level is 12.6%. Percent of the red blood cell membrane, for those of you who are not savvy with that. And the reason that's so important is that the normal range is something, and when I say normal, I mean a broad swath of the so-called quote-unquote healthy population is something like 4 to 10.
Yeah, 4 to 10 is kind of the range.
The only 10 I've seen that I can recall that was obtained solely through food was a young man who was eating a pound of fish a day.
Yeah.
An heroic amount of fish. And his mercury level was very elevated.
That's right. So that's a perfect example, Doc, because the thing is here you are, a la Jack Cruz kind of bull crap. The thing is like omega-3s are wonderful and they're from seafood.
That's a fact.
Yes. Okay. Boiled peanuts are marvelous to me too as a North Carolina boy. Okay. But if I ate a whole number 10 can, I don't think my health would do very well.
No.
Okay, so so is flaxseed, so is spinach, and so are turmeric, and all the other things, and lemons. But here's the thing: how much are you going to do? So the only way you can get a level like that is if you're taking supplements.
It's a fact.
Okay, and so we know that right off the bat.
And have you ever seen somebody coming through the door who had an omega-3 level over 10 who was happy with their health?
No.
Me neither.
Never.
I'm waiting.
That's the funny thing. Now, my sweet spot is 6. I like a 6%er.
You like a 6? Spot
on. Yeah, I'm 6%er.
Okay, got it.
Yeah, I like that number. It works out best. Could I go 8-ish? Yeah, but I think 6, all in all, there's a range.
Yeah, of course. And there's so many other factors.
Anybody 3 or below, they have problems too.
There's a problem.
Okay.
Yeah.
So, moral of the story, you don't take things without constantly quantifying. The second Q leads us into measure and monitor. So quantify across the systems how it can affect. Because, I'm going to eat all this healthy fish. It's a quality protein. It's wild caught.
The micronutrient content in fish is amazing.
It's amazing on paper.
The minerals.
But then you overdo it. And then now it comes along with the possibility of metals such as mercury, which creates a secondary problem, right? It's like people say, oh, well, gluten's bad. Well, that's not true. Wheat. We had some for lunch.
We did.
Lovely French onion soup with a toasted piece of gluten-rich bread on top.
Mm-hmm.
Pretty amazing.
Yep.
So the thing is that things come along with other things. So this is why you can never singularly find yourself singular or take one thing and assume that it does all the other things, right? So we want to measure where we're at when we start, and we want to continue to monitor it as we supplement, because sometimes we do need to supplement on fish oils.
Yeah, right.
Okay?
Right. And I mean, one of the things that makes me a little bit nervous when I tell people to take supplements, because some people don't listen to me carefully enough, believe it or not.
I know. Well, they're standing in front of the tube all the time or watching, TikTok or Instagram.
I know, right? But they're also
so convincing of them.
They're not used to anyone telling them to stop, because whenever we give instructions on a supplement, take X for Y amount of time.
And that's another hallmark of a trained clinician. Mm-hmm. All balanced protocol clinicians know to do this. When we prescribe or give or recommend a supplement or a dietary thing, we're going to tell you the basis of it based upon a lab, a separate objective marker that substantiates its need or use, and then we're going to say we're going to test again and evaluate, and we're going to stop you here, right? So, like if you needed quercetin or N-acetylcysteine or magnesium glycinate, name it, we're going to say for 2 months, for 3 months, for 4 months. And quite frankly, most supplements, we usually don't go more than 4, 6 max.
Right.
We've never really had the need to go past that.
And we're always getting after patients to fix their diet, to fix their nutrients. Yeah. Because if you are eating right for your body, your physiology, your environment, you don't need supplements.
That's it.
And that's the really uncomfortable fact that makes us really unpopular with some people.
I know. They're like, but the soil is so depleted. True.
Facts.
I get it. So I understand a multi and different things like that. Maybe that's another topic another day. But that's really what this boils down to is you should always have an entrance and an exit strategy of any drug or supplement, any pill, potion, or powder that you take.
Yeah.
And how do you do that? Through Q2M2 application.
And not just the pills, potions, and powders, but I mean everything. The red light therapy, the UV therapy, and all this stuff.
All the things. It's true. Everybody just constantly, they're like, oh, no, I see all the pictures all the time, all the biohackers, which I can't stand. They're the epitome of bastardizing Q2M2. They don't use it. They just say everybody should have red light, and it's amazing.
Yeah.
And they're in it all day long. It's amazing. So that's exactly right. Too much of anything can become toxic or a poison or an overload.
And I just had a patient he just started red light, started to have some off days. I said, look, cut it out. Cut it out with a bunch of other stuff too. Because I don't know if it's the red light or if it's a supplement or if it's a lifestyle or something that's going on. So we just simplify the clinical picture, stop this stuff, reintroduce it, see what happens. Focus is always on getting the patient better in a way that's responsible without doing things that other people do, like overshooting them on things and driving their system into some extreme, like copper toxicity or zinc toxicity or the deficiencies of these minerals and elements and vitamins. Because what people don't appreciate as well is that if you're driving something like zinc into a system, you can drive down the molybdenum, the manganese, and the copper.
There's always an exchange.
Problems.
Yep. Man, that's so brilliant. I'm glad you mentioned that. I almost forgot about that principle. And so that's really what it comes down to, folks. So we want you to make sure that you understand the next principle, balanced protocols, Q2M2, qualify, quantify, measure, monitor. Really understand that any strategy out there that has a clinical application needs to be justified and monitored and discontinued. You should always have a time when it's going to stop, okay? And resist the impulse to where like, well, I did this diet or I took this particular, pharmaceutical or nutraceutical, and now I'm better. It's therefore because and only due to said pill, potion, or powder or diet. And that would therefore mean that if I stop any of that, I will return back to where I went. I understand that, but it is absolutely incorrect. It means you didn't do it right. You should not have to be determined. It's like unemployment. Yeah, if you could get unemployment all forever, why would you work? I mean, if you wanted to stay at that bracket of income, right?
Sure.
Okay, so good. But no, it's just designed as a temporary stop-loss gap or an assistance. That's why it's called a supplement. It's supplementing something. It's not a primary. We don't call them primaries. They're called supplements. You got to make fun of that. Right. So Q2M2 is the principle. You've seen it clinically pan out and make all the difference in the world.
Only way to fly.
Only way to fly. And so that's the second big tenet of balanced protocol we wanted to share and give you guys some context of today. So hopefully that makes sense to you. So stay tuned in our next video. We're going to get into another principle of when we refer to doing those things that we've Q2M2 through the context of being a category of one is order of operations, doing things in the right order. So hopefully we'll see you back in the next video.